High blood pressure affects nearly half of all adults in North America. If left untreated, it can have devastating effects on our health. Dr. Padma Naidu joins us tonight to talk about what we all need to know about hypertension. Before we get started, tell me in the comments where you're watching from and let us know if it's your first time joining us. Dr. Naidu, thank you so much for being here with us tonight.
Thank you for having me.
So, I'd like to start out by having you explain what hypertension is and why it's often referred to as the silent killer.
Hypertension, also known as high blood pressure, is a condition in which the force of the blood against the artery walls is consistently too high. When this pressure is high over time, it can lead to health problems like heart disease, stroke, kidney damage, and vision problems. Hypertension is called a silent killer because it typically has no obvious symptoms, even when blood pressure is dangerously high. Many people with hypertension are unaware that they have it, allowing for the condition to progress and potentially cause severe health issues over time without any warning signs.
So, Dr. Naidu, how many Canadians are living with high blood pressure now?
So, an estimated 7.5 million Canadians have hypertension right now, according to the data from Canadian Health Measures Survey conducted between 2016 and 2019. Approximately 23% of Canadian adults aged 20 to 79 years had hypertension.
Many more questions for you, Dr. Naidu, but we are going to pause here and do our trivia question. If you answer our question tonight, folks, you'll get some great tips for eating less sodium while still enjoying your meals. And you'll get that guide for free if you answer our trivia question, which is true or false, regular exercise can help lower the risk of heart disease. Is that true or false? Can regular exercise help lower the risk of heart disease? Put your best guess in the comments, and you'll get those tips for eating less sodium delivered to your Facebook Messenger inbox for free. And folks, if you can think of any friends or family members who might find the show helpful, please tag them in the comments so they can tune in too. Dr. Naidu, what is considered a healthy blood pressure reading? Like, what's a number that we should feel good about?
Hypertension is diagnosed primarily through blood pressure measurements taken over time. A healthy blood pressure is actually 120/80 millimeters mercury or less. A single high reading doesn't necessarily mean you have hypertension. Rather, doctors constantly look for consistently elevated readings over multiple visits to confirm the diagnosis. So, the blood pressure is measured using two numbers. The systolic pressure is the top number, which is the pressure in the arteries when the heart beats, while diastolic pressure is the bottom number, is the pressure in the arteries when the heart rests between the beats.
So, how is hypertension typically diagnosed?
Hypertension is typically diagnosed with taking a blood pressure reading. A single high reading does not necessarily mean you have hypertension. Rather, doctors constantly look for consistently elevated readings over multiple visits to confirm the diagnosis.
So many people only get their blood pressure checked at the doctor's office. Should we be monitoring blood pressure at home?
Absolutely. Hypertension Canada continues to emphasize the use of home blood pressure monitoring or out of office blood pressure monitoring to rule out white coat hypertension. White coat hypertension is high blood pressure that is found in office measurement as a result of the presence of a healthcare provider in front of you. The anxiety related to the visit can lead to the blood pressure being higher, but that does not necessarily mean that you have hypertension.
Got it. So if we're only seeing high numbers in a doctor's office, but when we check our blood pressure at home, it's normal, that means we don't have hypertension consistently. It just means we're anxious in the doctor's office, which I can completely relate to.
Exactly. So that is very important to identify because we now know that subjects with white coat hypertension have an overall cardiovascular risk that is same as that of people with normal blood pressure. So there is no need for blood pressure lowering medications in subjects with white coat hypertension.
So when we check our blood pressures at home, if we're seeing higher numbers and those match the higher numbers we're seeing in our doctor's office, that's when we really have hypertension and we really do need to be paying attention to blood pressure.
Exactly.
And for people who should be monitoring blood pressure at home, how often should they be checking their blood pressure?
Good question. For patients who measured the blood pressure at home, the recommendation is to check the blood pressure before breakfast and 2 hours after dinner before taking the medication. They also recommend that duplicate measurements should be done in the morning and in the evening for about 7 days. Then it is recommended that you average the results, excluding the first day's readings.
For many people with high blood pressure, it's not being managed well. Tell us, what are the long term health risks of uncontrolled hypertension?
Yes, it is true that for a lot of people with high blood pressure, it's not managed very well. And the reason is hypertension is mostly asymptomatic. The key long term risks associated with uncontrolled hypertension are heart disease, stroke, kidney damage, vision loss, peripheral arterial disease, as well as dementia. Other life threatening diseases like aneurysm can also develop from uncontrolled hypertension.
In case you're just joining us, we're here with Dr. Padma Naidu talking about what everyone should know about high blood pressure and how to manage it. And we're giving away a super helpful guide for eating less sodium while still enjoying your meals if you answer our trivia question, which is true or false, regular exercise can help lower the risk of heart disease. Is that true or false? Can regular exercise help lower the risk of heart disease? Put your best guess in the comments and you'll get that low sodium guide delivered to your Facebook Messenger inbox for free. Dr. Naidu, when it comes to treating hypertension, what are the first line approaches you recommend?
The first line approaches to treating hypertension usually include a combination of lifestyle changes and, if needed, medication. Research shows that the DASH diet can significantly reduce blood pressure. The dietary approaches to stop hypertension diet, that is the DASH diet, emphasizes fruits, vegetables, whole grains, lean proteins, and low fat dairy while limiting red meat, added sugars, and saturated fats. Now, activities like walking, cycling, swimming, and jogging can help lower blood pressure by strengthening the heart and improving blood flow. The goal is usually about 150 minutes of moderate exercise per week or 75 minutes of vigorous exercise. Adding resistance exercise 2 days a week can improve overall cardiovascular health. Yoga and stretching exercises can help with stress management, which indirectly benefits blood pressure as well. And lastly, losing even a modest amount of weight, like 5 to 10% body weight, can have meaningful impact on blood pressure.
So, you mentioned weight loss as something that's really helpful for blood pressure. How much weight do we have to lose to start seeing a benefit for blood pressure and heart health in general?
Losing even a modest amount of weight, like 5 to 10% of body weight, can have meaningful impact on blood pressure. For example, for a 200-pound person, 5% weight loss would be losing about 10 pounds. And even that much of weight loss can start showing impact on lowering blood pressure.
So, what role do medications play in managing hypertension? And are there common side effects that people should be aware of?
Medications play a crucial role in managing hypertension, especially when lifestyle changes are not enough to bring blood pressure to a safe range. The goal of hypertension medications is to reduce blood pressure to lower the risk of heart disease, stroke, kidney disease, and other complications. It is best to discuss with your doctor the possible side effect of the medication that is being prescribed to you.
So, is hypertension reversible, or is it a condition that we're going to have to manage for the rest of our lives?
Unfortunately, for the most part, hypertension is not reversible. For most patients, hypertension requires lifelong management.
So, we're going to have to keep taking the medications, keep watching the sodium in our diet. It's going to be something that we're going to have to pay attention to for the rest of our lives.
For the most part, yes, for hypertension management is for lifelong. However, if there was a major life event that happens, for example, you lost a lot of weight, it is possible that your blood pressure medications have to be lowered by your healthcare provider because you might not need the same amount of medication that you needed before.
So, how does stress affect blood pressure, and what techniques can patients use to manage stress and keep their blood pressure numbers in check?
Stress can significantly impact blood pressure, often causing short term spikes and potentially contributing to long term hypertension. When stressed, the body releases hormones like adrenaline and cortisol, which causes the heart to beat faster and the blood vessels to constrict. Over a period of time, repeated spikes in blood pressure due to stress can contribute to the development or worsening of hypertension. Exercise releases endorphins and improves mood and reduces stress. So, regular aerobic activity like walking, jogging, cycling, or swimming can help lower blood pressure by improving heart health and blood vessel function. Yoga and meditation have also been associated with lowering stress, which in turn helps lower blood pressure.
So, what role does genetics play when it comes to hypertension? So, for example, if both my parents have high blood pressure, does that mean I'm more at risk for it as well?
Absolutely. Genetics plays a huge role in hypertension. If both your parents had hypertension, there's a significant risk for you to develop hypertension.
So, all the more reason I need to be paying attention to preventive strategies and thinking about what I'm going to be doing to keep it lower.
Absolutely.
Dr. Naidu, you mentioned earlier that weight loss can have a significant effect on lowering blood pressure. Do you have any strategies for the folks at home to take if they're concerned about their weight and how it's impacting their blood pressure?
Sure, weight loss has actually shown to reduce blood pressure. About 5 to 10% weight loss can be associated with significant impact on lowering blood pressure. To start paying attention to your diet and activity level will be the first step in managing your weight. Of course, we now know that there are other interventions available, like psychological interventions for management of weight and obesity. We also have weight loss medications now available for which you have to reach out to your healthcare provider.
Dr. Naidu, you're also a physician who focuses on obesity. Tell us about the good news of all the new treatments that are now available for obesity management that we really didn't have 5 years ago.
Yeah, it is actually quite exciting to see the amount of research that has happened in obesity in the last 5 to 10 years. This is because we have finally started recognizing obesity as a chronic medical condition. So there is more than what diet and lifestyle can do to us when we are trying to lose weight. And this is where the research comes in. There's a lot of medications which work via different pathways with the final goal to achieve weight loss. And not just losing weight, we want a sustainable weight loss. And that's where we are studying at different interventions and different medications to see if this creates impact on the weight. And why are we so interested in weight loss? Because we now know that improvement of weight results in improvement of blood pressure, diabetes, and as well as long term cardiac outcomes as well.
Dr. Naidu, thank you so much for joining us tonight. This has been such an important conversation.
Thank you for having me.
And a big thank you to everyone watching at home. We so appreciate you being here and chatting with us in the comments. Before we go, here's the answer to our trivia question. True or false, regular exercise can help lower the risk of heart disease? The answer is true. If you didn't get to answer the trivia question, but you'd still like those tips for eating less sodium while still enjoying your meals, just leave a comment for us and tell us what you thought of the show. We will be back to you with a new episode in a few weeks. Until then, please stay safe and take good care. Good night.